Fernando Fonseca joining us. How are you doing there, doctor?
Hello, how are you?
Hey, good morning. How are you?
Fine, fine.
That's a great background. Where are you right now?
Actually, in my home.
Okay, super. Another beautiful day in Panama. So, doctor, thank you for joining us. Just to give you a little bit of introduction, you guys, Dr. Fonseca is a medical doctor, a general practitioner. He has a company called Healthcare Alliance International, which came across our radar because he's doing some really great things for American expat veterans in this case. But really, he works with a wide range of people. His specialty, and of course, doctor, please, I'll also allow you to. Would be appreciative if you could give a bit of an introduction to yourself as well. But he's doing awesome things. Let me just say that. So the idea for today's conversation, guys, is to learn about what he does. Also talk about sort of the general state of medicine in Panama. Talk a little bit about the COVID vaccination and where we are as a country right now with a medical professional. So yeah, without further ado, Dr. Fonseca, how are you, sir?
Hello, good morning. Uh, Fine, everything. We are in a pandemic. It's complicated for everybody, but I'm just a quick review of what I do is I'm the head doctor of a group called Healthcare Alliance, and we provide medical services for veterans here in Panama through the FMP, TRICARE, and CHAM-VA. We have four clinic, and also
Cut
we
out.
have. Do you hear me?
Yes. Cut out a little bit. You provide benefits for veterans.
Yes.
Go ahead.
Yes, we provide benefit for veterans through his FMP, his Foreign Medical Program from the VA, and also we provide TRICARE and CHAM-VA. We have four clinics. We have one hospital here in Panama, and also we have clinics in Colombia.
Yeah, and when you came across my radar, doctor, it's so great to know that there's a resource like your company. Guys, for those of you that don't know, maybe you're not American, maybe you're not a veteran, but disabled veterans in the U.S., Army, Navy, Marines, does that also police officers, Dr. Fonseca, or no? Do they fall into
Anybody who has a
TRICARE?
disability and is under FMP can be covered here in Panama and overseas.
There you go. I mean, God bless America for providing those kind of coverages overseas. That's one of the reasons that Panama has been so successful courting expats is because their benefits are going to continue. So Dr. Fonseca mentioned earlier that they run four different clinics, if I recall, in David, Chitre, Chorrera, and Panama City, right?
Yes.
Okay, and then you also have a hospital in Panama City, in Brisa del Golf. So that's fantastic. So tell us a little bit more about Healthcare Alliance. Is it at all open to private citizens, or is it just exclusively geared towards those with the FMB, TRICARE, etc.?
Okay, Healthcare Alliance, it's mainly dedicated to veterans, but also we have clinics that are open to the public because we have all the structure. We have everything to do the medical attention to general public. We also accept national insurance and international insurance.
That's fantastic. So, and guys, this is not like a commercial for Doctor, although it's really awesome that he's got this business. it's more to inform the public, because if you're like me, you didn't know about this. So let's talk about the facilities in Chitre, doctor, because of course we have a lot of customers living in Perecí, thinking about moving to Perecí or Venao or even Las Tablas. Of course, Chitre is an easy 30 to 45-minute drive from there. Do you have English-speaking personnel on staff in these clinics?
In all of our clinics, our doctors speak English, and
How awesome is that?
yes, we have also our assistant in the clinic speak English, and in every clinic we have a VSO, a veteran service officer.
Okay. Yeah, and I believe you mentioned you also have seven pharmacies throughout the country. Are those open to the public as well, or is that by sort of membership or affiliation only?
Only two are open for the public. One
Okay,
in
which
Chorrera
two?
and one in Panama.
Hey, okay. Well, Panama Oeste and Panama, coincidentally, are two most popular regions. So, okay, awesome. Well, yeah, I mean, I really want to take advantage to have someone in your position to also now speak in general about the state of affairs in Panama. Let's talk about the vaccine. Let's talk about Panama's approach. We've gotten a little bit of bad press, but everybody complains about everything in the world, right? It's not
Yes.
just los panameños, it's not just los extranjeros, it's todo el mundo se queja, pues. So let's talk about your perception of where we are right now in terms of COVID in Panama. What are your thoughts?
Okay, it's something that it's difficult because we 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 we're in front of a virus, of a pandemic, and it's not easy to manage, not only for Panama, for all the countries.
Everybody. Yep.
Yes. So Panama has tried to do the best he can, and I think right now things are getting into track. We are receiving from Pfizer 60,000 doses of vaccine weekly from this week ahead.
All right.
So that's good because uh, we are insurance vaccination for around 240 doses per month. And then,
Can you say that again? I didn't understand about the 240 doses per month insurance. What did you mean by that?
because we are receiving 60,000 doses weekly.
Weekly. Okay.
Yeah.
So,
And also we have agreement with other three companies like Moderna, AstraZeneca, and Johnson and Johnson. So I think for October we're gonna have controlled all the pandemic, all the infections of the virus and everything.
full vaccination. So,
Yes.
are you aware of any order of distribution? I mean, I know they're giving like first responders, obviously all the politicians. But for example, let's say you're a foreigner. You've been in Panama during the entire pandemic. What would you advise a foreigner to do in terms of maybe you're an at-risk foreigner with some health factors, age, etc.? Is there a way to get registered for the vaccine, or how are they kind of dealing with that?
Yeah, the health minister here in Panama
Sucre.
has a web page. Then you can register over there. You put all your information, and in Panama the vaccination will be through groups. The first group is the group that it's in front of attending patients with the virus, internal medicine, intensive care units, personnel, and all that stuff. and then they will go with the second group. That is the group that is people under 60 with
Okay.
comorbidities, and they will move that way. And we think September is the date. September, October will be the date that at least 60% of the population will. We can uh, we can have the herd immunity.
Herd immunity, right? Okay, so it sounds like there are groups like 60 years or older. Are the first people going to be, say, with the Caja de Seguro Social after the first responders? Or, I mean, let's say I'm a 60-year-old expat right now with insurance from donde sea, Blue Cross Blue Shield, and I want to get on that list. So I need to go to the Ministerio de Salud website and just put my name in. Is that pretty much it? Get on the waiting list?
Yes, yes. In the health minister webpage, you will find a link for register for the vaccination. Also, they will have an app. That it will be soon in these days launch, so you can register over there.
Okay, that's great news. Good. Yeah, I mean, hey, every country's dealing with it uh, as they see best, and Panama at least is, making that money go to get those vaccines ordered. Eso es lo importante. So yeah, very good. Doctor, some other questions. I think you froze there for a second. Some other questions for you, if you're still there, is just about the overall state of medicine in Panama. If you could speak to some expats about facilities that are available. We've had a very good experience with Hospital Nacional as well as Punta Pacifica in the city. You still there, man? Que va, se cortó. Okay, so it's just me now. Well, whenever you come back, yeah, guys, I mean, I tell you what, healthcare here has been very good. As Dr. Fonseca mentioned, his facilities, as well as a lot of the national facilities, including Hospital Nacional, which is in the city, Punta Pacifica, also in the city, have some incredible facilities, like cutting edge, all the specialists you can imagine. In many cases, English speaking. If not, there's always a liaison in the hospitals. Insurance is generally pretty inexpensive. We pay for 2 kids and a wife whose public age is 28 and a dad whose current age is 41. We're paying $350 a month, and that gets us, very low co-pays, really great coverage on, shucks, we lost them completely. Really great coverage in terms of specialist access and also the percentage the insurer picks up on these hospital bills. So people move to Panama because of the healthcare. They're looking at Ecuador, they're looking at Mexico, they're looking at Belize, and they come visit one of these cutting edge. Johns Hopkins is affiliate of Punta Pacifica right here in the city, and they're as good as it gets as far as equipment. Now, I have a soft spot for National Hospital, Hospital Nacional, also a private hospital. We've had 2 kids there, multiple broken bones, multiple overnight stays, and exceptional. Like all the way down to the people that, clean the floors, the people that do the billing, of course, the doctors, the receptionists. It's been a consistently really, really just lovely experience, because hospitals can be awful, with the bureaucracy, et cetera. So, okay, well, it doesn't look like we're going to get the doctor back, but how about that, huh? A resource for veterans in Panama, and TRICARE, anyone that's on TRICARE or receiving foreign medical benefits, you need to talk to Dr. Fonseca. Great guy, obviously speaks English. We'll get his details here. I'll put it in the chat right now. It's Health Alliance International. There you go. Unless you don't have any questions, that's it for this week. Live, Facebook Live. Thanks for tuning in, guys. And, he's back. El doctor Ta-da!
Technical problems.
Hey, gaje del oficio. No big deal, sir. I have technical problems every Friday. The people that join us usually get a little giggle out of that. Cool, man. So, hey, doctor, otro consultas. Let's talk about medicine in general in Panama. Oh, there's a really specific question. Charles Davis, is a DD 214 needed to prove military service? Dr. Fonseca, do you know what that is, a DD 214? Are you there? Medical problems. I mean, medical problems. Connection problems again. And Nicholas, cool. Well, you know, that's awfully generous of your prime minister. I think we're good, but I don't speak on behalf of Panama. Yeah, Charles, sorry, man. Frederico's having some outdoor internet issues here. Let me see if we can get him back. 2-1. De vuelta, doctor. Negative. All right. We'll have to do this again sometime. Anyway, guys, that's it. We'll give him a couple more seconds. Charles, he'll get an answer to you via chat. Nicholas, onwards and upwards, buddy. Fortunate and less fortunate, I suppose, is all a matter of opinion, isn't it? We consider ourselves very fortunate down here, especially this time of year with some nice weather. Thank you guys for joining us. Have a great day, Doctor.